On March 27, 2024, stakeholders from across Uganda gathered at Hotel Protea for the launch of the Uganda Learning Hub. This collaborative effort, aimed at enhancing immunization equity, brought together key organizations and experts with a mission to reach every child, including those who have been missed by conventional immunization programs. The event commenced promptly at 9:15 a.m. with welcoming remarks from Moses Kamya, setting the stage for what promised to be a day of insightful discussions and meaningful collaboration.
So these learning hubs were created. You can see the countries that are involved. It's not only Uganda, but it's Bangladesh, Mali, Nigeria, as well as Uganda. And the reason is to understand, what is causing people not to get immunized, what is causing some communities to be missed.
The Zero Dose Learning Hub is about identifying and reaching, measuring, monitoring and advocating for the zero-dose children as well as the under-immunized children and also the communities they live in. So it's summarized under what we call the IRMA framework.
We were commissioned in Feb 2023, but we have been putting our foot on ground and establishing ourselves and concretizing how exactly we are going to operate. So this was a good timing for us to actually launch officially and tell people officially about the Learning Hub in Uganda, and then also share preliminary findings from the work that we have been doing so far. So today was an important day for the Learning Hub.
Following the opening remarks, Dr. Gustavo, representing Gavi, took the stage to emphasize the importance of the Uganda Learning Hub and its potential to drive positive change in immunization coverage.
Everybody heard already about the zero-dose agenda, right? And we get a lot of questions from people about what does that mean? What does the DTP1 indicator means? Like why DTP1? How do you measure it? So I wanted just to give you a little bit of a glimpse on what does that mean for the global alliance. So the zero dose is a new approach for an old problem, right?
So in Uganda's immunization schedule, a child is immunized at 6 weeks with DPT1, at 10 weeks with DPT2, and at 14 weeks with DPT3. So if a child gets to the age of 1 to 2 years and they have not received DPT1, then they are termed as zero dose. If they are aged 1 to 2 years and they have not received DPT3, they are termed as under-immunized.
If a child misses immunization, maybe is missing so many other things. That is the same kid who is not getting wash interventions, not getting ITNs, and therefore suffering from malaria, is not feeding well, most likely not going to school.
The Zero Dose Learning Hub initiative is an important step towards strengthening Uganda's immunization program using the evidence that will be generated.
Dr. Alan's words set the tone for a day filled with rich discussions and brainstorming sessions.
I can as well do the launch, the Uganda Zero Dose Learning Hub Immunization Equity.
Representatives from various organizations, including district health officers, statisticians, assistant district health officers, and member organizations such as UNEPI, the Uganda Pediatric Association, PATH, Public Health, CDC, and Compassion International came together with a shared goal to ensure that no child is left behind when it comes to immunization.
There seems to be an increase in the number of zero dose, and we see challenges like accessibility. bridges are not stable, the roads are slippery. It's a risk to even reach these children. So we have cross-cutting barriers to reaching the zero-dose children. Health workers have been reported that they take long to go for outreaches, and when they come to these communities, it's very hard to believe, but it's coming out that they give us multiple injections for all that, the time that they didn't even come.
The times that some of these mothers are available, it's not the time the health center facility is open. Sometimes there is limited supplies of certain vaccines in the health facility. One health facility is overstocked and another one has limited supply. And so the mother goes to the health facility and this particular vaccine is not there. The other bigger challenge is the limited health workforce. You find 2 or 3 health workers at the health facility and they're in charge of everything.
In terms of the survey that is going on, we hope we can be able to have over 900 responses giving us information about the children. So the survey is happening in households, and the interviews are being conducted with mothers as well as caregivers of these children.
And for this secondary data, I must highlight that this data is the house-to-house registration data that was collected by UNICEF. And then we selected the sites, as I alluded to earlier, Wakiso and Kamuli. So far we've done several interviews with some parents, village health teams, health workers, district health teams, and we're yet to come to national level. But these interviews have only been done in Wakiso.
The discussions that followed were dynamic and thought-provoking, with stakeholders raising important questions about the definition of a zero-dose child, the barriers to immunization access, and the best practices for sharing findings with the broader program. The day culminated into a panel discussion where experts from various fields shared their insights and experiences, sparking further dialogue and collaboration. As the event drew near to a close, there was a sense of optimism and determination in the air.
The day was very successful. It went very well. It actually went better than we expected. So the EPA program is very busy. They are currently preparing for the yellow fever campaign, and so they are usually supported by partners. So the timing of the launch was a bit challenging because we're all struggling to get their time because of competing priorities, but we are glad that they made this a priority.
The launch of the Uganda Learning Hub marks a significant milestone in Uganda's journey towards achieving immunization equity. With continued collaboration and dedication, we can ensure that every child receives the protection they deserve.